This Chinese farmer never thought he would chop off his own leg. But that's exactly what Zheng Yanliang says he had to do to survive. The 46-year-old got a life-threatening disease, but couldn't afford to pay for the surgery at a public hospital here.
The system isn't fair.
Zheng's action was extreme, but his experience in China's healthcare system is not. Few topics can engender as much passion as healthcare. Everyone seems to have an opinion on what system works best for their nation.
None, zero, can ever again be dropped or denied coverage for a pre-existing condition like asthma or back pain or cancer.
At the heart of the debate, how do you make sure medical care is affordable for everyone without stressing a nation's finances? Imagine trying to figure that out in a country with 1.3 billion people.
The government has made it their goal to have some kind of public health care coverage for everyone in China. But, you know, it's a matter of how much coverage can you give? How much can you cover liver transplants? Can you cover, you know, chemotherapy that costs a lot of money?
To help their citizens realize the China dream, the leaders here need to tackle the ailing healthcare system, one that's falling short of people's needs, burdening the public with rising costs and hampering the economy. Everyone is hoping China's consumers will help the world ride out tough economic times and eventually drive future growth. The Chinese economy currently relies on factories and investment, not so much on spenders. But Beijing wants that model to shift. The current healthcare system is a major hurdle to this vision of economic transformation. Too many Chinese people, worried about future medical bills, save rather than spend.
The new leadership recognizes that improving healthcare is a priority. Lawmakers have been discussing ways to change the system, which the premier has said is in uncharted waters.
We need to provide a last resort for people to fall back on in times of special difficulty. As China is still a developing country, our basic welfare benefits are still quite low. The government must prevent frequent occurrence of instances where people become homeless or have to give up seeking medical treatment because they can't afford it. Just imagine what if such situations happened to us.
So how did China get to this point? It is, after all, a communist country, so you'd think it would have a fully nationalized healthcare system. Well, it did, under the leadership of this man, Chairman Mao Zedong. Back in those days, if you got sick, you could go to the hospital for little or no money, or one of an army of what were called barefoot or village doctors would tend to you. The care was pretty basic, but covered nearly the entire population. Then, after 1978, under the new administration of the great reformer Deng Xiaoping, China started opening its economy. The government pulled funding for Mao's medical system, forcing healthcare providers to finance themselves, even as the state retained full control.
There was less government investment and healthcare was no longer taken care of by the government. As a result, when a country no longer invests, how can hospitals keep themselves afloat and ensure their own survival and development? Collect money. Money from whom? Of course, money from the patients.
Decades later, aware the new money-based system was frustrating the public, the government rolled out billions to expand healthcare coverage to the masses. Now, 95% of the population has some form of public health insurance. However, the coverage is uneven and depends very much on who you are and where you live. Chinese citizens spend more out of pocket on their health care than people in the UK, France, or the US.
So the result is a healthcare system that's supposed to be public, but actually it's overcrowded, underfunded, and the level of care that you get depends on how much money you have in your wallet.
That's how it was for Farmer Zheng. While at home one afternoon in early 2012 at his village in Hebei province, he says he suddenly felt pain in his right leg.
It felt as though someone was cutting my leg with a knife. I couldn't bear it.
So he went to a local clinic and got a shot. A few hours later, he says he visited an area hospital in the nearby city of Baoding.
I had an electrocardiogram there. They said I lacked potassium. They gave me a shot. I couldn't stand the agony that night, so they gave me 2 painkillers.
After a battery of tests there, he said he was told the next day to go to a more advanced hospital in the capital, Beijing, where he says he underwent more thorough checks. The doctors discovered, he says, that a blood clot was choking off circulation to his leg and that he needed surgery right away. The deposit, he said, was roughly $50,000, and as with all procedures in the public system, would have to be paid up front.
I asked if I could choose a conservative method. I spent a night there and had an IV put in my arm. I left on January 30th. I couldn't afford to pay.
His condition, he says, wasn't on the list of critical diseases covered by government insurance, and he wouldn't be able to claim reimbursements till later. As a farmer, he says he only earned $330 a month. His life savings, $33,000. After returning from Beijing, Zhang says that he visited this hospital. This is a typical hospital outside the big cities. He says that the doctors told him that they couldn't do anything more for him and that he only had 10 days to live. So he and his wife came home.
None of the hospitals would accept him. All we could do is go home and wait for him to die. We couldn't believe it. After returning home, I felt as if the sky had just fallen on me. I asked myself, who can help us now? Who can save him?
Over the next 3 months, they say his leg turned black and started to rot. Feeling he had no other options, Zhang says he decided to save himself.
The saw was under my bed. I grabbed it. The small knife was over here. I pulled it out and scraped the maggots away. I took a back scratcher and with the towel I had used to wipe my sweat, I wrapped it like this. Then I bit down and sawed off my leg, like this.
He says 20 minutes later, he was done. His story sparked public outrage over the gap in China's medical system and how people, often from the countryside, fall through the cracks. After his case drew nationwide attention, the local hospital offered to amputate his other leg where the infection had spread and to clean up his other wounds at no cost. Companies have offered to fit him with prosthetic legs, even coming on a day when we happen to be there.
This doesn't hurt. It's just that when I lean back a bit, I feel some pain.
Well, after the amputation, your blood circulation isn't good, and if you sit there for too long, the circulation slows down.
Zhang isn't sure how he'll survive long term. He spends most of his days quietly at home. He no longer farms, but he and his wife sell corn and wheat from their family plot, earning $655 a year. His then 17-year-old daughter quit school to support the family, but earns little.
My biggest worry is that I might have a relapse. I don't want that. I just don't have the money for that.
And not having money is a headache for anyone looking for treatment in China's ailing healthcare system.